All right, so we're going to go ahead and move on into our next presentation, which is working as a team. So we've been talking about process redesign, process analysis, and we can't do it without a functioning team. Is that right? So some of the items that we're going to talk about in this piece is what is a team. We're going to define what is a team and how it actually improves patient quality. We're going to define each individual role that is composed in the team, mostly from our member centers. We're also going to talk about leadership. So as we go through each one of these roles, I'm going to be pointing out leadership. We're going to spend a little bit of time on that as well. We'll talk about what makes an effective and successful team. And also we'll discuss communication. So obviously, it takes teamwork. So we've been talking about quality. Again, we've been talking about process analysis, process redesign, effective patient care, and it all takes a team in order to achieve that quality. There's actually 5 principles that are team-based in our healthcare environment. There's 5 principles that I want to talk to you about. So we have shared goals, clear roles, mutual trust, effective communication, and measurable process and outcome. So if we take a look at the first one, shared goals. So again, concept of the team. It's not a one-man show. We're not here to outshine everyone else in our team. Shared goals meaning that we're working as a team towards one goal, and that goal is our patient care. So we need to make sure we have the best interests for our patient. We need to make sure that everyone on that team has clear roles defined, expectations. We need to make sure that everyone on that team knows exactly what they need to do, clear expectations, responsibilities, and accountability. I know we've been talking about accountability throughout the day, and that's something that some of our centers actually lack, accountability. So we want to make sure that we have clear roles and understanding. Also, mutual trust. This is actually the current that flows through the entire team. We need to make sure that we trust each person in the team. Is that right? So I need to make sure that I trust my colleague, and not just within the same team, but across other teams as well. And obviously, effective communication. And we can really actually factor this into any aspect, whether it's work-related or personal lives. We need to make sure that effective communication is in place. So obviously, this is the lifeline of the team. Is that right? We need to make sure that communication is provided actively, meaning constantly, at all times. Communication needs to be open communication across all times. It needs to be accurate as well, and quick. We want to make sure that if we're going to provide feedback, if we're going to communicate, whether it's a suggestion or a concern, that it's done immediately. And then once we've applied those 4 principles, those first 4 principles that I've been talking about, then obviously our last principle here is that it needs to be measurable. So we need to make sure that the process and the outcome is measurable. So is it working? Is our teamwork working? So we talked about process analysis, process redesign, where it's a constant moving cycle, right? Same thing for teamwork. We need to make sure that the process, as I mentioned, and the outcomes are in place to ensure that everything is working and that we are actually working as a high-functioning team. So as I mentioned, with all these principles, and because of the communication, because of the outcome, that's where the learning happens. So as I mentioned, it's a continuous circle. So we bring it back to the table. We see what's working. We see what's not working. We make changes. And we continue to work as a team as far as meeting our goal of patient quality. So obviously, the team is not one person, right? There's no I in team. So it's not one person, it's a group of roles, a group of individuals that are composed as part of this one team. So the actual roles that I'm going to talk about are more geared to our clinical members, right? Our center members, as far as the clinical staff goes. I'm going to talk about administration and support staff, physicians, clinical support staff, allied health, and ultimately the patient also. So let's actually break down each individual one. So first we have administration and support staff. So if we think about a structure, so this is the foundation of our structure, right? So without a strong administration, without a strong support staff, we have a wobbly structure. So that's the composure of the team itself. So we need to make sure that the administration runs efficiently. The administration staff and the support staff run efficiently. They're not necessarily working directly with the patient. And they need to make sure, this kind of staff also needs to make sure that the nurses and the physician have all the resources they need for that care for the patients. So when we're thinking about administration support staff, perhaps we're talking about C-levels, executive, management. So again, we need to make sure we have the support of this team, or of this role, I should say, in order to have that strong team. I'm also going to be pointing out as I go through each one of these roles that anyone that falls into that role can be a leader. So we'll be talking about leadership in just a little bit, but please know that each one of these roles, we can have leadership within each one of those. And then we have the physician itself. These are our providers, our MDs, our DOs, our nurse practitioners. Obviously, these are the physicians that are primarily responsible for leading the healthcare team and making sure that we guide the patient to their accurate care. They help determine the treatments and perhaps engage other team members or other roles in that team to help assist the patient in resolving their illness or injury. And they also work with the patient. So as I'm talking about all these working as a team, remember we have to incorporate the patient also. The patient is part of the team, as you'll shortly see. So we want to make sure that the physician obviously works directly with the patients and teach them how to prevent these illnesses or diseases. And the patient can also be a leader. We want to make sure that we empower our patients. And as working as a team, having open communication obviously allows the patient to be more empowered in their own care. Next, we have the clinical support staff. So the clinical support staff, we're talking about the RNs, the LPNs, the medical assistants, maybe even care coordinators. Sometimes this role is kind of considered like the extender to a physician. Obviously, they work very closely with the physician and they work and assist the physician in the care of that patient. Communication, obviously, in this role is key. They need direct, concise communication. And as you can see, anyone that falls into this role can also be a leader. Another role that's part of the patient's care team, part of the patient's care, is the allied health professionals. And sometimes these staff that works inside this role doesn't necessarily work directly with the patient. Sometimes they work behind the scenes. So obviously I'm focusing more on meeting quality as far as the clinic team goes, but for us at Health Choice Network, some of us may not be on the front lines or work directly with the center staff. Sometimes we work behind the scenes, and obviously we play a vital role to meet these qualities also. Some examples would be dietitians, patient navigators, pharmacists, radiology techs also. And then ultimately we have the patient also. So remember, our goal is quality for the patient's care. And we want to make sure we empower our patient. This is actually the most important role, the most important person in the entire team, the patient. The patient does rely on, obviously, the entire care team, the entire team itself. They rely that we are working together, that we are communicating. And not only among each other, but to them also. We need to take account that perhaps the patient is vulnerable. Perhaps the patient is worried or is impaired in some way. So communication obviously has to be key there as well. So remember, the patient can also be a leader in themselves, in their care. So we're going to go ahead and move on into leadership. And as you recall, I've been mentioning that each one of these roles, somebody can play that leadership role. So with a raise of hand raise, who would classify themselves as a leader? So a leader is someone who demonstrates what is possible. So by the show of hands, what I saw was mostly someone that's in a management director role. But as I've been telling you, each one of you can play a leader within your own role, right? So some of us are born leaders. It takes a lot of work, but some of us are born leaders, and perhaps we have the leadership inside of us. We are just maybe don't want to, we're in our own shell, or perhaps we don't want to take that extra step. But do know that each one of us can play a leader role in our departments. So like it says there, leaders emerge from many different levels. You don't have to be that C level or that director role. Any one of us can play that. So if you're looking to become a leader, I'm going to share with you some of these traits that are part of leadership. So somebody that falls into a leadership role, obviously there has to be competency, meaning they're being efficient in their role, in their department. They're forward-looking nature, or they have forward-looking nature, which means being progressive and thinking ahead. You know, somebody that thinks outside the box as well. Inspirational. Obviously, we have to be encouraging to others, right? If we're just a leader that just doesn't show by example or lead by example, then perhaps we're not going to be that inspirational person that we need to be. Intelligent will obviously be another option as well, or another trait. Knowledgeable. You need to be knowledgeable in the information, or in the workflow, or in the process, and what the team needs, or what each employee needs. You need to make sure you're also fair and broad-minded. So you're not going to be easily offended. So if you have a coworker or colleague that comes to you with a suggestion or a change or a new idea, we want to make sure that it's taken, and they're not offended. Courageous. You get out of your comfort zone and you can actually make a decision. Another trait here for leadership is straightforward, meaning you address the issues by going straight to the matter. You're not beating around the bush, if you will. And imaginative. So as I mentioned earlier, thinking outside the box. So as we talk about process redesign, process analysis and process redesign, we definitely need somebody that's imaginative, that thinks outside the box. Some of our center's workflows are set to medical manager days or paper days. We want to make sure we evolve with the system, we evolve with the time. So new ideas, thinking outside the box is definitely a trait for leadership. Now we're going to talk about some signs and behaviors of good leaders. So perhaps I've instilled maybe an idea of some of you becoming leaders in your own role. Well, I'm going to give you some additional information of how you can actually get there by giving you some signs and behaviors of that role. So a leader, or the leadership itself, is about actions and results, not only within your same team, but across other teams as well. A good leader actually doesn't happen overnight, right? As I mentioned, some of us are born with that trait to be leaders, but for some, it's not something happen overnight necessarily. It actually takes work and practice. Another sign or good behavior is that the leader also understands that opportunities exist, or that can be created, and actually turns them into results. So a leader is going to see if there's a new project, if there's a new idea that can be part of the team or something, a new workflow, a new process, and actually makes it happen. And also has conviction, meaning beliefs and opinions. So becoming more of a leaderful organization. There's actually a book. It's called Creating Leaderful Organizations. It's written by Joel Raylan. So in this book, he talks about becoming more leaderful and how it requires that people adopt new behaviors. And he actually calls these behaviors the 4 C's of practicing in a leaderful way. So I'm definitely giving you more insight, more tools to become that leader, right? So we're going to start by concurrent, the first C here. And as I go through these, I want you to see how this isn't a one-man show. As I go down this list, it's all revolved around teamwork. Okay? So this isn't how to make you shine. This is how to make the entire team shine. So concurrent, meaning it's a shared leadership. So the group itself can very well be led by more than one person, which actually improves the outcomes, the goal that we're trying to get to. So some of you might know that saying that says, don't put all your eggs in one basket. So we don't want that to happen. That's definitely a failure for that team. We want to make sure it's shared. Next is collective, meaning the team leads as a unit. Again, it's not one person, it's a team. The entire team is moving here. So perhaps one person might be knowledgeable in that process or that idea or that content. However, you're making it happen as a team. You're all coming together and making perhaps one joint decision. Also, collaborative is our 4th C here, how to become a leaderful organization. And this is that all share a point of view and bring something to the table. So again, you have that one person that might be more knowledgeable in that topic, but we are all collaborating. We are all coming together, working as a team. We're all sharing different ideas and making it all happen at the end. And then lastly, compassionate would be our last C here. Results show when the leader is valued across the team. So the team members' views are considered before actually making a decision. So we talked about process redesign. We're going to talk about onboarding later on as well. So for this to be a successful team, we have to make sure that we're all on the same page and that all team members are considered on what that next step is going to be or that change is going to be. So anybody wants to become a leader? Again, you don't have to, yay! Again, you don't have to be a C-level or a directive role. You all have that in you to actually become a leader in the role you are in now. Now, there are some barriers, right, that we might come across that doesn't allow us to work as a team. So we have working conditions, resources, and team composition, or certain items within each one of these that can actually be barriers for our team. So the first one we have, and it's really a big one, not only internally for us probably, but definitely we hear it as we go through our workflow visits at all of our centers. We do hear that the first one does play a major role here. And that is lack of coordination. Perhaps lack of direction, poor management. So obviously, in order to have a successful team, I need a strong leadership, right? So we talked about leadership, and it doesn't have to be a one-man show. It can be any of us to actually make this a success. Distractions. That's definitely a barrier in our team effectiveness. Distractions, perhaps technology can be a distraction. Our cell phones. Our cell phones can be a distraction to working as a team, making and accomplishing our tasks for the day. Our personal lives can also be a distraction, where we're bringing our problems into the workforce. And like Sandra said earlier, the front desk role. If she's having a bad day at home and brings that to work, then she has really set the tone for the entire day of all those patients that are walking in. He or she, I should say. Another barrier for working conditions is misinterpretation of cues, meaning mixed communication. The message didn't get across. And some of these misinterpretations can actually be verbal. Maybe my tone of voice, the tone of my voice can be a miscommunication there, or having the wrong tone, I should say. Another cue is nonverbal. Posture, my body language. Perhaps I'm speaking in a candid way, I'm speaking in an okay way, but if my posture, my body says something else, then you're not going to understand what I'm trying to tell you, or we're not going to work as a team. As far as resources, we have lack of time, and like Brian mentioned earlier, time is of the essence in our organization, as well as all of our centers, where they try to see many patients in very little time. So lack of time can play a role there, how we may not work as a team properly. Another big one that we see across our centers as we do our workflow analysis is the workload, where staff is being overworked, or one feels that they're being overworked versus the other. So we need to make sure that the participation of that team is balanced. Technology can also play a barrier. So if you don't have the right tools that you need to accomplish your work, your job, your tasks, that will definitely play a barrier. Whether it's monitor size, the size of the monitor. In our organization, perhaps having a third or a fourth monitor allows you to accomplish and work more efficiently as a team. So now the team itself, if we struggle within the team itself, we're definitely going to have issues, right? So if there's conflict within the team, if there's conflict from peer to peer within the same team or across other teams that perhaps need to work together, obviously that's going to form a major barrier in the success of the team and the success of the entire organization. Lack of communication, I'm sure we can relate, right? Lack of communication, whether it's inside the team or across other teams, whether it's verbal communication, email communication. If the message is not getting across, obviously we're not working as a team, especially when we're not involving all the players that need to know. Lack of role clarity. Imagine if you come to work every day and you're not too sure what you need to do. You're not too sure what your expectation is. That is definitely a barrier to the entire team. When you perhaps have to be guiding someone continuously of what they need to do, or they're not understanding what they need to do. You've been assigned a new project and you're not sure what the outcome needs to be, or you didn't get clear expectations of what the project is. Obviously that's going to form a barrier to the team's success. And perhaps not understanding the different communication styles. We all communicate differently, we listen differently, we speak differently. So we need to understand all those different variances as far as communication styles go. So we talked about barriers. So now we want to talk about one of the items that makes an effective team. So again, the whole concept of team is working together, right? That is what mutual support is, really. It's working together. I actually had the pleasure of presenting, as part of this ONC grant, I had the pleasure of presenting a module a process that's called Team Steps. And in Team Steps, again, it's working as a team, the concept. And in Team Steps, they talk about one of the models, which is mutual support. Which basically means being aware of your surroundings. So it's not like you're getting to work, you're going to do your job, and it's 5 o'clock, you're out. You need to be aware of your surroundings. Where else can you help? Who needs help? Or do you need help yourself, right? So mutual support is you're seeking support, or you are lending a hand, you're lending support to someone else. So you're constantly on the lookout for your surroundings, see where the help is needed, and working as a team, essentially. Mutual support is also known as like the backup behavior, right? Where, again, you're somebody's backup. Again, it is critical, obviously, to the team performance as well. So some of the benefits of mutual support, it minimizes the workload because you're all supporting and working together. It increases effectiveness. It makes you more of a successful team. You know, you want to make sure you work smarter, not harder. It obviously helps prevent errors. So if we think about our centers, you know, as far as the patient's workflow, if we're working as a team, perhaps somebody's catching a fatal error. You know, perhaps a patient's allergy or the medication isn't listed properly or the allergies aren't listed properly. If we're helping each other and catching these mistakes, obviously it's going to help prevent errors. We're able to assist one another with mutual support. And obviously, a benefit would be that we are able to provide and receive effective feedback. So, as I mentioned earlier, feedback is where the learning happens. You know, if somebody has done something incorrectly, I want to make sure I address it constructively with that person and address it. And not just tell them they did something wrong, but then back it up with how to do it right. And it's not just the negative feedback, perhaps it's also positive feedback. We also want to make sure that we reflect on the wins as well. In previous presentations, as you are here today, one of our centers showed a video, and I've been talking about it since. The video is actually called, Why is Your Boat Still Sinking? Okay. It's actually about employee engagement. So if we're not working as a team, then think about it or compare it to a sinking boat, right? So the video is called, Why is Your Boat Still Sinking? Ultimately, we're all on the same boat, right? So I'm going to go ahead and break up our staff in 3 different categories. So think about a boat in the ocean, and you have 3 different groups, just to give you that visual. So 30% of the people in that group are engaged. They're actually paddling really hard to keep that boat afloat, right? Then you have another 52%. That's a big percent. That's more than half. 52% are disengaged, meaning they're along for the ride. Those are your 9 to 5s. I'm here to do my work. I'm done. See you tomorrow. Those are the people that are just along for the ride. And then your last 18% are actively disengaged, meaning they're on purposely trying to sink that boat. All right? So I've broken up that boat into 3 groups: engaged, disengaged, and actively disengaged. So when we talk about effective teams, don't we all want to be in that engaged group to keep that boat afloat? Because if we're not working as a team, that boat's going to sink, right? It's going to be a failure in that team effort. So after all, our goal is quality of the patient's care. And obviously, in order to have an engaged employee, obviously that allows us to have quality and an engaged patient also. If that patient sees that you're not there to keep that boat afloat, then they're just going to follow your lead also and be disengaged as well. All right. So now we have our activity, our communication activity, and that's what that sheet of paper is for. So this is a fun activity about communication as far as a listener versus a communicator, right? So I handed out a sheet of paper to each one of you. Everyone has their paper? Yes. So just like Sandra did earlier, I have rules. I'm sorry, there are rules. So I'm going to go ahead and read out the rules to you, and then we'll follow along each step that's part of this activity. So I want to let you know, first of all, that your eyes need to be closed when we do this activity. All eyes closed. And we have cameras looking, so we know who has their eyes open. So all eyes closed, okay? You cannot ask me any questions as I go through the activity as well. Okay, so no peeking, no questions. Are we ready? Are we ready? Okay. All right. So put your pencils down. We're not taking notes on that paper. No notes. So I want you to grab, again, eyes closed. Everybody eyes closed. Just listen to what I say. Eyes closed. So what I want you to do is hold the paper in front of you. Grab the paper and hold it in front of you. The first thing I want you to do is fold your sheet of paper in half. Eyes closed. Can't ask me any questions either. Now I want you to tear off the upper right-hand corner of your paper. Now fold the paper in half again and tear off the upper left-hand corner. Fold the paper in half again. And lastly, tear off the lower right-hand corner of your paper. All right, looks like everyone's done. I want you to go ahead and open your eyes and display your sheet of paper. It needs to look like a snowflake.
Everybody, we'll see.
Hold it up.
Hold it up, hold it up.
So look around. Look around at everybody's sheet of paper. Does it, I know snowflakes, not one snowflake looks the same, that I know, but take a look and look at everyone's sheet of paper. It all looks differently.
Brian, you got them?
Did anybody tear up their paper, like in pieces? So we have some with 2 holes in the front. We got 3 holes. We got like a little butterfly effect going there. We have a Pac-Man for Umair. Jillian, I gotta say, you fold it this way. I hadn't seen that. In all the times we've presented, I hadn't seen So why do you think no one's paper looks the same?
Specific instructions.
Specific in the sense, right. Specific in the sense because I gave the same instructions to everyone, right? But perhaps I didn't allow you to ask me any questions. Everyone hears, listens differently. And it's just not the listener, again, the communicator can be at fault too. Like you said, like Terry said, my directions were not clear. And again, I didn't allow room for questions. So that ultimately is a failure, right, in the communication line. So we want to make sure that as far as communication goes, that we communicate effectively. So that was a fun exercise. So as I was mentioning, communication, again, it's just a basic transfer of information, an exchange of information from the communicator to the listener and vice versa. As I also mentioned, it's the lifeline of the team. And as far as the patient goes, it's vital. It's vital for the patient's safety. So if that front desk is not communicating with the clinical support staff, if the clinical support staff is not communicating with a provider, or the provider's not effectively communicating with other providers of that patient's care team, obviously it breaks that lifeline. We need to make sure that we have a clear understanding. Again, my instructions to you were not accurate, perhaps, and you were not able to ask me questions. So obviously there was no sender-receiver understanding there. And everyone needs to know what you're communicating with. Know who you're communicating with, and obviously the how as well. So if I can summarize here as far as communication goes, obviously no communication will definitely equal poor patient care and ineffective teams. This is a health grade survey, patient safety and patient satisfaction report. It's from 2012. So as far as our clinic staff goes, nurses and providers, 27%, because of poor communication, there was 27 more of safety events because of lack of communication or poor communication. And there was 15% also of more safety events from the provider side because of poor communication. There was also another report from the Joint Commission from 1995 to 2006. It was stated that the leading root cause of sentinel events reported was because of poor communication. So how can we communicate effectively? Again, not just among ourselves or across other teams. Again, keeping the patient in mind as well. It needs to be complete, significant, and that all the parties are included in that understanding, allowing questions and allow answers as well, a thorough answer as well. It needs to be clear. Everyone understands what we're trying to communicate. If we're trying to communicate with the patient or a family member, perhaps I need to use layman's terms also. We want to make sure the patient understands. It needs to be brief, concise, and to the point. You don't want to go on this huge explanation and then at some point I've lost what the point of this conversation was. So imagine if it's a patient in the discharge phase of the visit and you're not communicating effectively. Right there, you've set the patient for failure, if you will, in the terms of patient empowerment. Now they don't understand what you need from them. So we need to be complete, clear, and brief. And lastly, timing. Immediate feedback. I know I've mentioned that a few times, but it is so important in terms of working as a team. We need to make sure that we provide feedback, whether it's negative or positive. Regardless, we're going to learn from it. And it needs to happen immediately. Something can occur today, and then I'll bring it up a month later in the monthly meeting. It needs to be immediate, okay? We're going to go ahead and talk about team huddles. So some of our centers have incorporated, as far as care coordination, they have also incorporated team huddles. Some of our centers do team huddles in the morning, some do it in the afternoon, some do it ad hoc. Some don't do it at all. But team huddles is where the team comes together and prepares the day's event. Some of them might even prepare from the day before for that team huddle. So there's actually 3 elements that make a powerful team huddle. So again, this is the clinic team coming together to talk about the patients that are coming in that day. Talking about the quality measures that need to be met for that patient that day, or health reminders. Are we working maybe on a skeleton crew? Who's here today? Which providers are here? What's the schedule? What's the backup plan? So that's what they're talking about in the team huddle. So those 3 elements that make it more effective are communicating the vision, provide clarity, and demonstrate unity. So as far as communicating the vision goes, meaning it's a shared vision of the team and the organization. So each company has a vision statement, right? So we need to make sure that it's communicated regularly. And it's a great way to start that huddle, talking about the vision of the organization, the vision statement of the organization. So if we want that vision statement not to just be in their heads, but also be in their hearts, then it needs to be communicated regularly, not just posted on the wall. Also provide clarity. So as mentioned, everyone needs to understand their roles and expectations. So today, the team huddle is done on a daily basis. So today we're going to talk about who is working on what. So everyone understands what is expected from them. And obviously demonstrate unity. So we want to take the time also during that huddle to talk about wins and maybe even employee recognition. So it's not necessarily the leader talking here about wins and recognition, but even from peer to peer as well. So again, we are working together towards that one goal, and we want to make sure we're not leaving any outsiders. So everyone speaks, and we want to demonstrate unity as well. I actually have a video to show you about a sample team huddle, and then we'll touch base on it afterwards.
The Patient-Centered Medical Home really has called on us to bring what they describe as a team-based approach to care. And that means that you apportion different tasks and different patients' needs to individual persons on the primary care team. And at Community Health Center, that core team includes a medical assistant, a nurse, and a primary care provider. In addition, may include a pharmacist, a behavioral health provider, or even a dentist. The morning huddle is a simple, quick touching base when that core team meets, reviews who's coming in today, and decides who's going to do what. It's basically intended to be brief, focused, and simply making sure that the team is all on the same page, pretty similar to a football team huddling before they conduct the next play.
The medical assistant is given 30 minutes the day before the huddle happens, and that's preparation time. And they can look ahead at the next day and see who's coming in. They use something called CDSS, which is the Clinical Decision Support System, which helps to cue them for different routine screenings that a patient may need.
It will pop out the alerts of what the patient is needing, whether it's blood work, whether it's certain tests, mammograms, PAPs, colonoscopies, or preventive medicine.
I get the list from Centricity and print it out, go to electronic medical records where all the patient's information is, and just go over each patient, do a little bit of research, what they need, and write it down.
They're also able to look for adult immunizations or specific needs for a patient based on their age group or a chronic disease such as diabetes. The medical assistant will have all of the prep work that they've done, all detailed and written out, and then the next morning, the medical assistant, the provider, and the nurse all come together.
Next patient is here for follow-up for diabetes. I noticed we need to do an A1C on him, and I believe a foot check.
What is the last frequency measure?
First A1C was done in
See the 13-year-old?
The huddle is really directed by the MA. I would say that the provider is guiding, but most of the information is coming from the MA.
You wrote down colonoscopy. I see you're not doing FOBQ or colonoscopy. Note that they've had a colonoscopy. If they don't understand, just offer the FOBC and let me know, and I'll talk about the colonoscopy.
Okay. So diabetic retinopathy is the leading cause of blindness. As a nurse, I want to add in the care coordination piece. Have any of these patients recently been discharged from the hospital? Have they been calling frequently? Do they need some self-management goal setting? Are there opportunities for teaching or for any roles for the nurse to come in and really build upon the work that a provider's done? That's really what we're looking for in the huddle. We also have to have a huddle system that allows us to have flexibility to accommodate planning and looking for routine screenings for a patient that may get booked later today. So we'll go in and again we'll look, and that team will meet again before the afternoon session and do the same thing, repeat, and sort of look at who's coming in this afternoon, and we move on for the rest of the day.
The huddle makes the day more effective because the primary care provider can lay out and really almost choreograph how each visit is going to proceed and who's going to do what. It gives them the ability to assign certain tasks like ordering mammograms or giving vaccines so that everybody on the team is on board and prepared to provide those services in an efficient, choreographed way. And what that allows the primary care provider to experience is a much more efficient, coordinated day where a team is working on each patient rather than just them.
As a physician, I think my flow go much easier, quicker, and more efficient. In terms of the patient, of course, we have a system that we not only double check information from the MA to the nurse to the provider, we make sure the patient get the best care.
It helps us anticipate for the day. It helps us keep a focus and kind of work as a team together. And and I think it helps to improve the patient outcomes. The benefits to me is that it takes me less time in the room with the patient because I know what I'm going to ask. The benefits to the patient is the efficiency and that I'm more knowledgeable of what they need.
The patients are really being seen in a more efficient, productive manner. Their wait time has decreased. The staff is more satisfied because their day is running smoother. And really our goal is to improve health outcomes, and we're able to do this in a timely fashion.
Really only takes a couple minutes and it makes a huge impact. It translates very quickly into high quality patient outcomes. And that's what we're here for. And that's why the huddle has been so valuable.
Well, I hope you get better. And if you need us, feel free to come back.
So as we talked about the huddle and the making an effective huddle, as the staff in that video showed, it obviously promoted high quality of patient care, right? They were able to better communicate internally, knowing everyone had that role expectation, clear role expectations. They were more efficient when they went into the room with the patient. So now they're not just blindly going into the exam room. They're actually going in already with a knowledge of what that patient needs for the day. Team communication, you saw how the provider said in that video where it's not the provider leading. It's not a one-man show. This isn't a team huddle for the provider. The MA speaks a lot. The nurse, the clinical support staff has to speak, and everybody shared something in that huddle. We talked about how we use that time to make recognitions as well, and obviously it makes more of an effective day. So I hope everyone takes something back for team huddles, right? So trickle down the information, work more effectively, work as a team, and know that you're all leaders. You're all leaders in your own role. So thank you.